Hello everyone, in this video we will know what are modifiers. 47 modifier. 47 modifier is when anesthesia is given by the surgeon instead of anesthesiologist alone with the surgery. It means that before any major surgery, anesthesia is given by the anesthesiologist to the patient. But instead of anesthesiologist, when the anesthesia is given by the surgeon, it means the one who performs the surgery. So when surgeon gives the anesthesia, in that case we should append 47 modifier. So this modifier is used in surgery section, not in other sections. For example, surgeon is given local anesthesia themselves for excision of small cyst. In that case, we should code excision of small cyst with 47 modifier. 50 modifier. 50 modifier is bilateral procedure. It means left and right side of the body. When the same procedure is performed on the both side of body, that is right and left, during the same session, in that case we should append 50 modifier. So bilateral procedure, it means two sides of the body. It should be in the same, it should be the same procedure, and it should be the same session, and it should be the same organ, like left ear, right ear, and right eye, left eye, same procedure and in the same session. Example, when the physician removing the impacted wax on both ears. So you can see the code here 69210. In the code description, removal impacted serum requiring instrumentation. That is, it is unilateral. The code is given unilateral. So you can see here down in the description, for bilateral procedure, report 69210 with modifier 50. So if the physician is doing two sides of the that is bilateral procedure in the same session, it means two sides of the body, two sides of the organ. So in that case we should append 50 modifier to the procedure code. So when not use modifier 50, if the CPT code already defined as bilateral, you can see here 55250 vasectomy, it is given unilateral or bilateral. Already they have given bilateral, it means both side of the body. Then in that case we should not append 50 modifier. And for the procedure performed on the different organ, if the procedures are performed on the different organs, for example right eye, left ear, so it is right and left bilateral, but it is in different organ, so we should not append 50 modifier. And when using right and left modifiers, in that case we should not append 50 modifier. 51 modifier, multiple procedures. When the physician perform multiple procedures during the same session, same day, in that case we should append 51 modifier. Always list the major procedure first, high dollar value, and append modifier to the subsequent procedure, that is low dollar value. So always assign modifier to the low dollar value, that is the last code we assign, that is the low dollar value. For example, physician performs multiple skin procedures, that is removal of cyst and removal of another lesion. Then code first removal of cyst and second another lesion, removal of another lesion with 51 modifier. As it is a multiple procedures in the same session, same day, we should append 51 modifier to the low dollar value, that is the last code which we assign to the CPT codes. And when not use modifier 51, so if the CPT procedures are already bundled, it means included. When the CPT procedures are included, then we should not code separately. In that case we should not append 51 modifier with ENM codes and with add-on codes and circle slash code. In these cases we should not append 51 modifier with add-on codes and circle slash. This is very important one. 52 modifier, it is reduced service. When the service performed is less than the described CPT code, in that case we should append 52 modifier. For example, physician has taken radiological examination of elbow, one view. So you can see here 73070. You can see the code description. Radiological examination, elbow, two views. In this procedure, they have given two views, but the physician has taken only one view. In that case, as it is a reduced service, it means instead of two views, he has taken only one view. It means it is a reduced service. In that case, we should append 73070 to 51 modifier. It is a reduced service. 53 modifier, that is discontinued procedure. When the procedure is discontinued because of patient condition. For example, when the physician performing upper GI endoscopy, suddenly the patient develops breathing difficulty. In that case, procedure has to discontinue due to patient condition. When the procedure is stopped or discontinued due to patient condition, like suddenly some conditions are occurred during the procedure. When the procedure is stopped due to that condition, in that case we should append 53 modifier to the procedure code. For example, another example, appendectomy. Physician is performing appendectomy. So, in that case, during the procedure, patient develops suddenly breathing difficulty and tremors. In that case, we should append 53 modifier to the procedure code. See 53 modifier to 44950. Major surgery, that is 56, 54, 55 modifier. Major surgery, it mainly includes 56, 54, 55 modifier. So 56 modifier, preoperative management only. The physician handles only preoperative care, that is evaluating the patient, preparing the patient before the surgery. When the physician evaluates the patient and prepare the patient for the surgery before surgery, then we have to code 56 modifier. For example, a physician evaluates patient, orders test and prepare them for appendectomy, but another surgeon performs it. So one physician is preparing for the surgery, that is before the surgeon. So he is evaluating the patient, ordering the test and preparing them for appendectomy, but is not doing the surgery, that is preoperative care. But another surgeon is performs it. So if the physician handles only preoperative care, in that case we should append 56 modifier. As the procedure is appendectomy and the physician is only handling preoperative care, in that case we should append 56 modifier to the 44950, that is appendectomy procedure. 54 modifier, that is surgical care only. When the physician performs only the surgery, not the preoperative, not the postoperative. When the physician only performing the surgery, in that case we should append 54 modifier. For example, a surgeon performs an appendectomy procedure, but he does not follow the patient after the surgery, that is postoperative care. When he performs only surgery, then in that case we should append 54 modifier to the procedure code. So as he performing appendectomy, the code will be 44950. For 44950, we should add 54 modifier as the surgeon is only doing surgery. 55 modifier, that is post-operative care. When the physician provide only the post-operative care after surgery. So the physician is not doing the surgery, nor is even taking care of patient before the surgery. After the surgery, when he handles the patient, in that case we should append 55 modifier to the procedure code. For example, a local doctor take care of the patient after the discharge from hospital where the surgery was done. In that case, we should append 55 modifier to the procedure code. Note. So, in this note, if three physicians involved, append modifier 54, 55 depending upon the information. For one procedure, if three physicians are involved, in that case we should append 54, 55, 56 modifier based upon the information. If only one physician involved, don't use any modifier code to the procedure. Only the procedure code should be coded, not any modifier should be assigned, because only one physician is handling preoperative care, is doing the surgery, and you also take care of the patient after the care, that is post operative care. Only one physician is doing it, means we should not append any modifier, we should only code the procedure code. Thank you for watching this video. If you found it helpful, please like, share and subscribe to my channel for more useful content. See you in the next video.